All right, everybody, let's talk about basophils. Before we even get into basophils specifically, we can look at the picture and determine that they are a type of granulocyte, like we discussed, because you can see all these little granules inside of the cell. So, basophils. Again, same picture. So, they are granulocytes. They only make up about 1% of your white blood cells, and they're relatively small compared to the neutrophils, but they're still pretty large compared to your red blood cells. I know that there's a lot of information here that's like it's just a lot, right? So the specific sizes of your cells and you know specific measurements of how big they are, the number of lobes found in the nucleus. It's a lot. So look, how do you stain them? So don't overwhelm yourself with that. Use these videos again to help you better understand the general characteristics, and then you can go from there. Right. So start small. Let's discuss this granulocyte, the basophil. So if we're looking at basophils, let's follow this out. Their main job, similar to neutrophils, is to migrate or move to the site of injuries. Very similar to how we talked about with the neutrophils. Again, up here on the top of the screen, if I have a blood vessel and I have my little red blood cells floating in it. So again, my blood vessel, maybe this is an artery and my blood is flowing. Maybe I have, let's do green this time. I have my basophils floating around in there. There's not a lot of them, but if there's an injury, so again, here's my skin, right? If there's an injury and something gets into my skin, and this could be anywhere in the body too, but I'm just going with something that will bring bacteria, viruses, something into the body, right? Anywhere there's damage, right? And potentially pathogens coming into the body, which again, maybe here's an orange, these little pathogens that come in, right? And you don't necessarily need pathogens. I'm just trying to show it. But anyways, something gets into the body, and what's going to happen is just like we saw with the neutrophils, these basophils have the ability to move through the blood vessels and go to the area where there's damage. Right? So that's just number one. They're very motile, meaning they can move really well. They're very mobile. Next, they also have the ability to attract eosinophils, which is another type of white blood cell. So, which it's kind of weird to think about for us because as humans, when we communicate with one another, we can see things like and hear things, just like you're doing right now with these videos. You're listening, you're observing things with vision, and we can talk to each other, right? We can write things down. Inside your body, cells also communicate, and basophils have the ability to attract or tell other cells to come join them in different areas. How do they do that? They release certain chemicals into the bloodstream. Next, here are a couple terms. They both start with H, which can get a little bit frustrating, but let's do one at a time. Heparin. Some of you guys have heard of this before. Heparin is an anticoagulant, right? Anti means the opposite. Coagulant is a term that means your red blood cells have the ability to come together and clot. So, in other words, heparin does not allow blood clotting. So if your bloods want to come together and clot for whatever reason, good or bad, heparin prevents that. Why would we want that? Right? I thought clotting was a good thing. What if I have a cut? Well, when it comes to fighting off an infection, especially if there's damaged tissue area, basophils are going to release heparin to make sure that the blood doesn't necessarily clot yet. And the opposite, it allows for more blood to come to the area. So again, if I only have 1% of my blood are basophils, right? My blood is moving through my blood vessels. If that's the case, I need as much blood to get to that area as possible. So we increase the amount of blood to the area by decreasing the amount of clotting. So heparin helps us reduce the amount of clotting. And also, some people will take that as a medicine, right? There's different types of blood thinners. All right, next up, histamines. So histamines also start with an H, and you may have heard of these before, maybe in some medicines, which we'll talk about in 2 seconds. Histamines. Again, I'm not saying antihistamines. Some people have heard of antihistamines. We're not talking about that right now. That's not what we're talking about. We're talking about regular histamines. What is the goal of a histamine? If you have histamines in your blood or in your body, you are going to cause inflammation. This is a good thing. Inflammation is a good thing when you have something in your body, right, that you want to destroy. So, inflammation typically increases the amount of blood. The more blood, the more you fight off. That's a good thing. Also, it's going to increase the temperature of the area. Bacteria and viruses do not like heat. They do not like heat. So the bad guys do not like heat. So inflammation and increasing the temperature is going to destroy these guys. So that's why your body wants to promote inflammation. With that said, sometimes there's too much inflammation and we have to take medicine to help with that, right? So you could have too much of a good thing. It's kind of weird to think about because most of us probably think about inflammation and increase in temperature as uncomfortable things, but they are good as well. Um, Sticking with histamines, let's talk about what we're familiar with, and that is antihistamines. A lot of us. Why would I take an antihistamine? Because your body went too far. So, for example, maybe you have allergies. So, if I have allergies, the allergen, which I'll make this little circle, gets into your body and causes inflammation, too much inflammation. And when you have too much inflammation, for example, if you have certain allergies, maybe you get headaches, maybe you get hot, maybe you get hives, right? Maybe your throat starts to swell up. Your body's overreacting. And then when your body overreacts, that's not good. That's not good. That's why it's an allergy. Allergies make your body overreact. So there's too many histamines. There's too many histamines. So if you take an antihistamine, it'll do the opposite and it'll reverse the effects of the histamine, and ideally it'll make you feel better, right? So that could be something dramatic like some sort of allergy that puts you into anaphylaxis, or it could be something as simple as some allergies, right? So like seasonal allergies like pollen or something like that. So antihistamines, I don't know if anyone heard my wife sneeze there, but that was good timing with the allergy stuff. Um, Antihistamines prevent the histamines from doing their job and reverse the inflammatory process. So there's a little bit of information there. Basophils are the ones responsible for these chemicals to be released in the body. If you have any questions, let me know.